Are there still many challenges with IFMIS in terms of and also control of budget?
Yeah, actually, where we spend a lot of time is the control of budget. If you see the last disbursement, it took us at least 4 weeks to be cleared everything. As I'm talking to you this morning, I was battling with my teams to make sure that the legal department of COB clears insurance for our staff. Don't forget the insurance expired. I've been negotiating with the insurance company that please don't discontinue us. But it's already 4 weeks now. The money we have in the account, but we can't pay because we are waiting for clearance.
Chairman, I mean, Governor, I thought SHA is working. Why are you taking private insurance?
Yeah, and I knew that is where Ogongo Mugen would not would want to go. I was just waiting for that. I thought the governor, I think I assist you, Governor.
Yeah.
I thought you meant other forms of insurance like car insurance, car cover. So why is Senator Ogongo Mugen quick to run to SHA? And by the way, he was missing in United Opposition rallies in Western. You should have said those ones in rallies, not in this committee.
Order, members.
Chaired by the broad-based chair.
There is a substantive audit finding on irregular procurement of insurance services. I think we can have that conversation when we get to it. Now,
you know, we keep learning. I want to understand. Teachers are covered by SHA. It's working. We, day in, day out, we get serious queries.
Share point of relevance.
From...
we are not discussing teachers.
Just a minute.
No, let me just prosecute, then we will.
Yeah, you have been asking us to ask some of the questions, yet when it comes to
I think let's allow Senator.
We are facing this problem, including where I come from, Nyamira, where you find we are paying a lot of money to SHA to cover employees working within the county government. And again, you are paying a lot of money to private insurance companies. Notice, I think we had a big issue is from Nandi, audit query. So I want to really understand, how do we progress as a country? When I was in the health committee last time, we had said if we have a universal health coverage, more money will be paid to that entity so that it's liquid to support universal health coverage. Now, with this idea of counties opting for private insurance, how do you reconcile?
Now, Governor, let's just to make sure that we are still relevant and in the audits, let's just examine that under irregular procurement of insurance services.
Thank you, Chair.
I think that's under lawfulness. It's the first paragraph on lawfulness and effectiveness in the use of public resources. Auditor General, so that it's not a hypothetical conversation. We can see how much Kilifi is spending on insurance and whether there could have been better value for money if it was done through a state insurance scheme.
Thank you, Chair. Irregular procurement of insurance services. Management engaged an insurance firm to provide medical services, medical insurance at a cost of Kenya shillings 398,331,861 per year through a contract signed on 27th January 2023 to run from March 2023 to 29th February 2024 with an option of renewing the contract by the client subject to an internal performance review by the client's representative, and a notice to renew shall be served to the service provider not later than 1 month preceding the end date. A new contract agreement was signed on March 2024 for a period of 1 year until 28th February 2025 with an option of renewal by the client subject to an internal performance review by the client representative, and a notice to renew shall be served to the service provider not later than 1 month preceding the end date. The contract was again renewed for a period of 2 months from 4th March 2025 to 4th May 2025 at a cost of Kenya shillings 79,666,373 through an addendum agreement dated 25th February 2025. However, based on the contract sum for the last 2 years, the prorated cost of the 2 months is Kenya shillings 338,643, resulting to an explained variance of Kenya shillings 13,277,730. This was contrary to Section 139, subsection 2, subsection A of the Public Procurement and Asset Procurement Disposal Act, which states that an accounting officer of a procuring entity, on recommendation of an evaluation committee, may approve a variation of a contract which shall be accompanied by a certificate from the tenderer making a justification for such cost extension of the contract period. In the circumstances, management was in breach of the law. Thank you, Chair.
Okay, Governor, your response?
Thank you, Chair. Chair, the county government of Kilifi did a fresh tender advertisement for the medical insurance services on the 18th day of February 2025. On the 25th day of February 2025, the county government of Kilifi received a complaint from an advocate on material governance issues to be addressed. On the strength of the complaint, a consideration for termination was initiated and the tender was ultimately cancelled on the 10th day of March 2025 following an advisory letter reference number PPRA stroke MSA stroke 5 stroke 10 volume .171 dated the 7th day of March 2025 from the Public Procurement Regulatory Authority. To avoid the risk of exposure of our staff and their dependents from non-coverage of medical insurance owing to procurement procedural delays, the accounting officer extended the contract with the service provider for a period of 2 months, pursuant to the recommendations from the Contracts Implementation Committee following a meeting held on the 25th day of February 2025. Further, the premiums for the 2-month extension were higher than the proportionate amount, since members had fully access to their full benefits for the 2 months, and the benefits could not be prorated. A risk premium of 20% was charged to cater for the members who might have assessed fully cover limits within the 2 months. Attaching hours of the 2nd day of March 2026 at pages 700 to 719 as appendix number 22 are minutes of the Contract Implementation Committee dated the 25th day of February 2025, authorizing extension of the contract to the accounting officer. 2, request letter by the county government of Kilifi for extension of the medical contract for 2 months, dated the 25th day of February 2025. Acceptance letter by the medical insurance cover provider for the extension of the contract from the service provider, stating the additional 20% risk premium, dated the 26th date of February 2025. Quotation for premiums from the service provider for the 2 months extension. Minutes of the Contract Implementation Committee dated 27th day of February 2025. Acceptance letter by the county government of Kilifi of the quotation of premiums dated the 28th day of February 2025. Letter referenced KCG PSM PO 2024/2025/volume 1 /07 and date the 18th day of March 2025 by the county government of Kilifi to the Director General, the Public Procurement Regulatory Authority. Letter reference EKA PPRA 006/006 and dated the 25th day of February 2025 by the law firm of Onindo and Associates Advocates to the Director General, the Public Procurement Regulatory Authority. Advisory letter reference PPRA/MCA/5 MSA /5/10 volume 1 71 and dated the 7th day of March 2025 from the Public Procurement Regulatory Authority. Thank you, Chair.
Auditor General.
Thank you, Chair. Based on the client's response, the query was asking for two things. One was on approval for the variation of the contract, the procedure that is applied, and a recommendation from the evaluation tender committee. Those documentation are not within the documents attached, and that was the basis of the query. So in terms of the response, the management was still in breach of the law. Thank you, Chair.
Governor, you have given a very elaborate response. Why can't it be supported by documentary evidence?
I don't know what time when we have tendencies sometimes here, which I always try to run on my officers, that the time they get the documents most of the time is when the auditors either have exited or whatever, but we have said we'll do it differently. We have been in communication with the AOG that during the entry and exit, when I'm there myself, I'll be able to get in between what they are looking and they are missing so that it's provided for. But in the meantime, Chair, if you allow us, we'll provide this to the AOG, ASP, as soon as possible.
It's not part of the annexures you have here, because I'm going through your Appendix 22.
I think the variation was not part of. There's some documents, but the variation I don't think is there.
Okay, so if it's not here, then the matter is still open. Now we might then ponder on the question raised by Senator Okongo Mogeni. You are spending 400 million a year on staff medical insurance. Can this not be provided through the Social Health Authority if they've got an institutional cover?
Chair, unless we engage, I know when we were in National Assembly at one time we engaged in HIF. Unless we engage, because you realize that the payments SHA do, SHA is working very well. From our hospitals, we can say the only thing we have is always the delay of reimbursement. Otherwise, payment for a client, when you walk into the hospital, you have been treated, and payment will be done and will release you. But our reimbursement now is what takes time. Don't forget, many of the private hospitals here have not yet embraced to take the SHA in their hospitals. So, and for us to be able to maintain the insurance for our staff and their families, we are still forced to keep this till when we have a stable and that many private hospitals can accept this SHA, then we can be able to engage our staff on that.
Governor, you note the contradiction.
No, there's no contradiction here.
Because you're saying it works very well. So
For us,
the question
in the
is,
government hospital,
if it works so well, why would you need to go to Amana Insurance Brokers and Britam, a private medical insurance provider?
Chair, why meant it works very well in the government hospitals?
In fact,
the private hospitals.
Governor, through the chair, you see, I don't know why you are telling us about a private hospital. I thought you should be telling us that you have public hospitals in Kilifi that can serve the people of Kilifi. Because health is devolved, you can make your hospital to be better than Aga Khan. And people of Kilifi will seek medical help from your public hospitals. You don't need to come here and confess that you are of the view that private hospitals are better equipped than our government entities. And then, just to borrow from what the chairman said, this meeting you had in Kilifi, if the problem with SHA is on defined benefits, you know, you can, as COG, you can make a request to Senate to make some amendments to the law so that SHA has defined benefits that can be accessed by the people working in your counties. If you want inpatient of a certain amount, outpatient, dental, you can make that proposal so that we can say governors are taking care of the health of people who reside in our counties.
Thank you, Chair. I think on that, Chair, what I must say is, one, it's a very good idea, and that's what I'm really looking forward. I have already engaged different partners who are locals of Kilifi to start providing a private wing at Malindi Hospital, eventually at Kilifi Hospital, so that all these facilities which
Yeah, Chair, that is dangerous. I don't agree with that because maybe we went with health committee. In one of the sub-counties governor in a level 4 hospital called Maraba sub-county in Tindred near Kisumu, they have done what you are trying to do. So you find where ordinary the Olopolois are walking into is very dirty. There's no drugs. There's no. But in the same hospital, the one they have is using that the SHA runs has everything, has drugs, has doctors, is very clean. So it creates two classes of citizens, which is dangerous.
So let's hear what is.
Yeah, we are not discriminating anybody, Chair. You will see the different type of services. The insurance does not only for it's not only for our staff. What we are trying to encourage now with the improvement we are doing in hospitals. I wish we got the hospitals at a level where we could already admit. But now you could see we are admitting some of the hospitals, and we have tried now to accredit even some insurances so that even any other person who does not work in the county but is insured can still be able to come and pay there. If they are not insured, they have another private insurance. That's where we want to go with hospital, but does not mean we are discriminating the other.
Without maybe the
hospital
governor
users.
going to private insurance or private wing of a public hospital, what is wrong with just enhancing SHA? Have you approached SHA to have something equivalent to enhanced NHIF for public servants? Because really, if you have 400 million pumped into SHA, I think it will work even better. So what are the challenges? Have you approached SHA? What did they say?
That's why I said they want to borrow the chairman and Senator Mugeni's advice that we engage a COG and engage SHA and see if we can come with better terms. I know that we did it when we had when we were in Parliament, when the former members, we have what was called FOPA, which we negotiated with NHIF, and they were paying for us substantive amount of money through NHIF to sustain, especially members who had left Parliament and they did not have insurance. So we'll approach SHA.
There was, I think, someone introduced themselves in a delegation as head of health or something, medical services. They've gone out because
Chief
really,
officer is here for health services.
that's a chief officer, health services. Now, chief officer, beyond what has been queried here, maybe just going back to Senator Mogeni's question, does SHA have an institutional product that can cover the employees of Kilifi? Have they developed something?
Yes, but there are some services, scope of services that by the time we are thinking of engaging the private insurance company, we had not set up. Well, I'll give an example. By that time, we didn't have a single CT scan in the county. So we had to refer those patients to another county, probably in private hospitals. So because of those services that we did not have at that particular moment, this idea of having...
We didn't have a CT scan.
Yes, but we do now.
And yet
yes.
we have sat here for the last 7 years approving money for managed equipment scheme. MES, which was supposed to provide those facilities.
Yes, but the management equipment services, the packages were not standard for all the counties. The counties were getting CT scans, others were getting MRI, others were lab, other counties were ICU. So for Kilifi, at that time, we did not have the CT scan, but we have now. We are actually having two. So I'm just giving that as an example, that the scope of services that, sorry.
How did you acquire that CT scan?
We procured one as a county, and then now there's the new National Equipment Program, the NESP. We have also acquired one CT scan through that program. So we have two CT scans now. So now there will be no need for even our staff to get these services from either the private hospital or
yeah,
out in the county.
And that's an important point, which maybe we can just deliberate on it a bit, and I like the information. So it means that what stops us from going full blast on SHA for employee cover is the sorry state of public facilities.
Yes, especially equipment and quite some services that probably the healthcare workers will run. Like, for example, we could be offering the general surgery through the normal way, but a healthcare worker would want to benefit from a service that he himself is offering. For example, laparoscopic surgery. We might not have the tower for laparoscopic surgery, but it's available in a private hospital. Yes. So
I get the point. I understand you. So the responsibility still goes back to the county government.
Because you see, it's you, Governor, to make your county hospital the most attractive facility. Like Chief Officer, God forbid, if you collapsed in your office and we needed to rush you to hospital, will we go to the county referral hospital or will opt to go to the private hospital?
Right now, I can confidently say that we are, and you will be able to witness that when you come to Kilifi, you will visit. There's a lot of investment that through the governor, His Excellency, have done, and we have all the services now.
Which one? So if we have which one?
The Kilifi County Referral Hospital.
Okay. You have a heart surgery?
Yes, we have a cardiothoracic surgeon. We have a cardiothoracic surgeon who just come to school. So we're in the process of equipping one theater out of the 6 theaters we have, so that we can have open heart surgery. In the moment, we did not have ICU. Now we have an ICU, so we can.
If you come from Speaker Kingi's village,
yes, Marafa,
and you had a problem, how long will it take you to get there? To your state-of-art facility?
About 20 minutes.
From Adu to Kilifi. From Adu to Kilifi will probably be 1 hour.
1 hour.
Yeah,
And
in
the
which
road
case,
is
1 hour plus.
the cardiac will be arrested by that time.
Yeah, but Chair, what we are doing.
Governor, as you respond,
now.
Governor,
Governor, as you respond,
again.
Governor,
because
the road is tarmacked.
Only I did 4 kilometers when I came to office of that road. Now the president has come up with a program to tarmac it all the way to Kamale.
So you might not have cardiac arrest, okay.
So, Governor, for some of us who were born in that era, when government was government, me, I was born in a government hospital. I saw that we are encouraging our women to go and deliver. Is it a level 2?
Yes.
Primary health care.
Yes.
Have you improved the beds? Because the last time we made a visitation in a health facility, Mama naza nalala kwa ile kitanda flat. In a private, you'll find this bed, they adjust. Unafinya tu namna hii, the way moyo went somewhere, inainuka tu pole pole. I don't know whether you have, that's what we are looking at. You know, some of us who believe in devolution,
Chair,
I don't know whether we have reached that level.
We have changed all that, Chair. When I came to office, we had only the fabricated beds. Now we have all the modern beds. Even when you have the business of you having family members to lift you up because you are too heavy to be treated by the doctor, we have now a remote control. You can turn anybody at any weight. We have about 16 of those. And then the other beds like Mombasa Hospital and Nairobi. When you come to Kilifi, Chair, I invite you to visit Malindi Hospital and Kilifi with me, and you'll see the transformation of health. The problem we still have, why we have all what we are saying, people, we still have to take insurance, we still very low on diagnostic. Where I sit since I came to office, and the doctors and the team here, they will tell you, what I'm really fighting for is diagnostic. We had no ICU working, we had only 1 bed, now we are at 11 in Kilifi. I am doing another 11 beds ICU in Malindi and HDU. By the time you come, we'll be full operational. We have finished constructing everything. You will also find that when it came to things like dialysis, they were non-existent when I came to office. So what I do through partnership with the Hungarian embassy, I got now a cooperation where they do placement of beds and we buy reagents. So now we have dialysis in Kilifi County. So if we put together all these things here, will not need to go to
No,
private
Governor,
hospitals.
you are scaring us. Because you can't say in 10 years,
Am I right?
when you came in, there was no dialysis,
ICU bed.
there was no CT
Chair,
scan.
that's why I
The
wanted
bed was
to-
one working chair. I didn't say there wasn't. There was one working.
I think we need to be fair to the past administration.
No, chair. But chair, they don't.
You have got a very beautiful mansion.
No, chair.
As a governor, it can't be that there was no dialysis.
I've never stayed in that mansion chair since I came
And
to
you
office.
even
But
say there was
nevertheless,
no CT scan.
How many dialysis beds do you have now? As we speak?
we have in Kilifi 5, total 11.
They all counted.
And we think with our cooperation with the Hungarian government, we're expecting 13 more. We had a problem with what is going on now. We should have saved the other 14 to expand.
Chair, maybe a nice.
But the truth, Chair, is I'm not trying to really this on what you do when you come. We'll take you in a small movie. You see how we took health and where we are now. Maybe you'll appreciate.
So, Chair, before we go to movies, can you tell us how many ICU beds do you have as per now? And then, Chair, maybe before you, just on indulgence, Governor, you remember there was that time of COVID, and there were creation of isolation centers.